Thank you for the many requests to discuss the physiotherapist's responsibilities when working with physiotherapy assistants. My name is Fiona. I'm a physiotherapist by background and I'm a practice advisor with the College of Physiotherapists of Ontario. Today's webinar will start off with a brief review of the Working with PTA Standard, followed by 3 themes from the Professional Issue Self-Assessment I'll call PISA that seem to be the most challenging for physiotherapists across the province this year. Finally, we'll discuss some common scenarios based on questions that we were asked to help resolve in our practice advice service.
And my name is Abbi Olanbiwonnu. I am a physiotherapist and a practice advisor with the College of Physiotherapists of Ontario. As we know, physiotherapist assistants are important members of the healthcare team. And the Working with PTA Standard sets the professional expectations for physiotherapists that work with them. And as a reminder, a PTA is anyone whom a physiotherapist assigns care to. Some physiotherapist assistants will have received a college-level diploma. Others may have training in kinesiology or athletic therapy. Some will be trained on the job, and others will have a different background. Regardless of the training or background, the expectations of the standard applies.
You're likely familiar with the Working with Physiotherapy Assistants Standard, but it's important to review or highlight some of the sections before we get started. Let's go through the 6 sections. First, the PT remains responsible for all care assigned to the physiotherapy assistant. Next, you can't supervise a relative or someone with whom you've got a close or intimate relationship. Third, you cannot assign skills you don't have, or the initial assessment or a reassessment of a patient, or a treatment that would require a physiotherapy assistant to independently modify the treatment plan. You can't assign controlled acts delegated to you. For instance, an Aspen collar you've been asked to fit for after a patient has a surgical fracture. Any part of acupuncture, communicating a diagnosis, spinal manipulation, and internal assessment or treatment of pelvic musculature. So the 4th section, assigning and supervising. You need to ensure the PTA has competency to deliver safe, competent care. You need to discuss the roles of each member, physiotherapist, physiotherapy assistant, and you need to get consent from the patient for working with a physiotherapy assistant. There needs to be a name of the physiotherapy assistant on an invoice, and you need to provide a suitable level of supervision to the PTA. The 5th section is about communication. There must be a written communication protocol that states how and when that the physiotherapist will communicate with the physiotherapy assistant and the physiotherapist will communicate with the physiotherapist. There needs to be a contact number, and there needs, when appropriate, needs to be a contact number for an alternate supervisor. And the final section is the responsibilities of that alternate supervisor. If there's a transfer of care, the alternate supervisor assumes responsibility for the patient. That alternate supervisor needs to have the knowledge, the skills and judgment, and can intervene as per any communication protocol. When you're assigning care to an assistant, there's many factors that you need to consider, from the patient factors, from acuity, chronicity, the predictability of the patient's change in their condition, to the experience of the physiotherapy assistant, their level of training. Environmental factors, are they going to be working alone? Are they in a team environment? Some of the physiotherapy treatment factors you need to consider: what's the technical skills required? Do you need more training? Do you need to provide more training, more support to the physiotherapy assistant? The complexity of the tasks, and what are the potential risks of harm related to any treatment or intervention? And how are you going to be able to provide supervision? to that physiotherapy assistant? How available are you to the assistant? Lots and lots of factors to consider. So as many of you know, the Professional Issues Self-Assessment, the PISA 2023 this year, focused on the Working with Physiotherapy Assistants Standard. Over 11,000 physiotherapists and PT residents completed the PISA. We loved hearing the stories about how you're collaborating and discussing the questions with each other to get to the answer. We understand that more PTs are working with PTAs every day in the delivery of care across practice settings, both public and in private settings. So physiotherapy supervision responsibilities are very important. So PTs and PTAs, they work as a team in the best interest of the patient. They need to provide safe, quality care. So Abbi, you're going to take us through a few questions from PISA this year, the ones particularly that challenged physiotherapists.
Yes, certainly. So based on some of the questions that physiotherapists got incorrect, so here are some of the key takeaways about the Working with PTA standard. So first, we're going to look at assigning care. We asked 2 questions in this round that a lot of physiotherapists got wrong. So the first one we're looking at was around the responsibilities of a physiotherapist who assigns oxygen administration to a PTA. Now, 1/3 of physiotherapists, and that is over 3,000 PTs, answered this question incorrectly. So I'd like to talk more about this question. Many thought a PT could not delegate oxygen administration to a PTA. While though oxygen administration is a controlled act that can be delegated by a PT to a PTA, but there certainly has to be certain circumstances that have to be met. The PT must complete an assessment of the patient first, and then form a diagnosis, along with the development of a management plan with the patient. Delegation to that PTA can occur if the PTA has the training, knowledge, skills to administer oxygen safely. The PT also needs to have a process to ensure that they have assessed the competency of the PTA to deliver this care. Like I said, there's another question that physiotherapists had some difficulties answering. So approximately 500 physiotherapists also responded incorrectly to the question whether the physiotherapist could assign a new modality to the PTA despite the physiotherapists themselves not knowing how to apply it. The correct answer here is the PT cannot assign the application of the modality if the PT is not competent to deliver it themselves. Even in situations where the PTA has been trained on the modality or has worked with the device, it still cannot be assigned to them. Remember, the physiotherapist is always responsible for the care that's been assigned to any patient. They also need to ensure the quality safe care is being provided by the PTA. So if they're not competent to deliver this care, they can certainly not assign it to the PTA too. So let's take a look at the next item here, which is assigning objective measures. So with objective measures, we asked the question around whether Jack, a PTA, could record a patient's range of motion. 25% of physiotherapists said no, that Jack could not do this. But the correct answer here is yes. So if the PTA has, again, the knowledge and skills to take the measurement, alongside with the fact that the physiotherapist has watched the PTA perform this activity and they're confident in their ability to carry it out, then the PTA can certainly take the measurement on behalf of the physiotherapist. Now remember, the physiotherapist remains responsible to collect and interpret the results along with any other relevant patient information that's going to be needed to form a physiotherapist diagnosis and of course develop a management plan for the patient. So the next thing we're going to take a look at is communication. So the practice advice team, we received many inquiries about what is expected in terms of communications with PTA. Every physiotherapist who works with PTAs must have a way to ensure that they're being updated by the PTA on the patient's status and adherence to the physiotherapy treatment plan. The PTA must be clear on the how and when they will discuss patient care with the assigning PT, and the PTA also needs to know how to contact the physiotherapist. Is it going to be by phone? Are they going to be having discussions face to face? And also the other thing to note is when and in what circumstances should the PTA actually be contacting the assigning physiotherapist or the alternate supervisor. Either way, as Fiona mentioned, this process must be in writing. And we know communication processes will look different in many organizations, large organizations with over 20 plus PTAs versus smaller ones with 1 or 2 PTAs. For example, there may be communication that occurs in morning team hurdles between the physiotherapists and the PTAs, or you have more scheduled team meetings. The bottom line is the physiotherapist must receive information around whenever the treatment has been, if the treatment has been implemented, and the patient's status and adherence to the physiotherapy program. And also if the patient is requesting any communication with the PT, the physiotherapist assistant needs to pass this information to the physiotherapist. Lastly, we're going to look at consent. As we know, a physiotherapist is responsible for gaining the patient's consent to involve any third party in their care, and this is inclusive of PTAs, students, or even volunteers. This is the law. A PT needs to explain to the patient the PTA's role in the care of the patient and how the PT will be supervising the PTA throughout this care plan. They also, the physiotherapists themselves, need to be available if there's any questions the patients may have surrounding their care, and also the involvement of the PTA. Most PTs in this year's PISA got this question correct. As a reminder, you definitely want to ensure that the consent discussions are being documented in the patient's chart. So we just reviewed the PISA questions. So now we're going to share with you some top inquiries that we as practice advisors get from yourselves, insurers, patients, and other external stakeholders around working with PTAs. For some context, the advice team receives over 8,000 inquiries in the year. And the working with the PTA inquiries is actually one of our top 5 types of inquiries received. So we're going to go through some typical questions and our responses to them.
So Abby, can I ask the first one? Would that be okay?
Go ahead.
A PT assigned care to an assistant yesterday, but is off sick today. Can the assistant continue care?
So certainly the assistant can continue care in the absence of the physiotherapist, but there has to be certain things in place here. There has to be an alternate supervisor available to support the PTA should the patient or the PTA have any questions around the assigned care or about the patient's condition. There should be a contact number or a way to reach that alternate supervisor. Now, if the patient has a question about their care, or perhaps they're struggling or have a new symptom, then the PTA should definitely be contacting that alternate supervisor. And at this point, that alternate supervisor now assumes responsibility for the physiotherapy care the patient's receiving until the primary PT comes back and assumes responsibility. So Fiona, I have a question for you. This is around billing. The PTA delivers the treatment plan designed by the physiotherapist. What must be on that invoice that we give to patients?
Okay, the invoice provided to the patient, it should include the PTA's name, job title, and whenever they've provided part or all of the treatment. Okay, back to you. Do I need to get the patient's consent to involve a volunteer in the patient's care program?
So certainly, you definitely have to be having that conversation with the patient. As we talked about previously, this is really important. It's a lot to get consent from patients, especially when we're involving any third party into their care, such as PTA, students, or volunteer. A patient has the right to agree or not agree who can be involved in their care. Now, the conversation about the involvement usually should occur during that physiotherapy assessment. Obviously, that may differ as to when you want to bring someone else into the treatment plan, but the patient must agree to the volunteer's involvement, and the PT should indicate this in the patient's chart. So the next thing we're going to be taking a look at here is competency. So Fiona, how do you know when a physiotherapist assistant has the knowledge and skills to deliver patient care safely and competently.
So you really want to have a conversation with the PTA, so you can be clear on the physiotherapist role and the PTA's role, and you both understand that together. You as a physiotherapist want to confirm the skills, the knowledge, the experience of the PTA. This can be done through directly observing them, or even accepting another regulated physiotherapist who you know, who you trust, has done an evaluation, and that can be acceptable. But there certainly needs to be a way of tracking it was done. That competency, that experience, that training was checked and was done. And you need to document it. You need to have documentation that that process has been followed. Importantly, the physiotherapist can provide that training to fill any potential identified practice gaps. And I just want to plug, we do have some resources on our website, a checklist that you can use when you're going through that process, checking a physiotherapy assistant's level of training, if there's gaps, how you've supported that physiotherapy assistant to get the right training. Okay, I'll ask one to you. The assistant has been working with a patient for 2 days. The patient finds the program too easy. The assistant wants to increase the level of challenge from the program. Is it okay that the physiotherapy assistant does that?
So certainly it's not okay that the PTA does this. As we spoke about, this is one of the things that cannot be assigned to a PTA. So the physiotherapist is the one that's developed the specific plan for the patient. So any deviation from this plan should really trigger the PTA to go back to that assigning physiotherapist to kind of discuss those changes. So the PTA should be communicating with the physiotherapist, so that way the physiotherapist can go in, either to have to do a reassessment of the patient. Ultimately, the physiotherapist is the one responsible for determining what the next steps are for this patient. So Fiona, our next thing we're going to be looking at here is acupuncture. So should the physiotherapist ask the PTA to remove acupuncture needles following treatment?
No, the answer is no. It's good we're repeating this question, which is similar to the one we asked in this year's PISA, where we found out about 200 physiotherapists got that question wrong. Physiotherapists may delegate the controlled act they are authorised to perform except for acupuncture, communicating a diagnosis, spinal manipulation, internal assessment or internal rehabilitation of the pelvic musculature. So, summary, PTs cannot delegate any part of acupuncture, and this is inclusive of removal of needles. So, next question. A PTA runs an exercise class in a gym. Is this physiotherapy? Why? Why not?
So there are a couple of things to consider when a physiotherapist assigns components of a treatment plan to the PTA. So for a group exercise class to be considered physiotherapy care, the patient must first be individually assessed by the physiotherapist, and there should be a customized treatment plan developed for this patient. It is not physiotherapy if the patient was never assessed. The assessment must include subjective and objective findings. There should be development of physiotherapy diagnosis, and there should be patient-specific goals that are working towards the treatment plan. Along with the treatment plan, there should be a plan for reassessment and also a plan for discharge. Now, the treatment plan could certainly include group-type exercises if they're clinically indicated, but again, there must be that plan for reassessment. And the physiotherapist who assigns these exercises must ensure that the PTA that's going to be running the class is competent to be able to perform this care safely. Now, remember, a PT cannot assign exercises they themselves are not qualified or competent to deliver. And it's also important to note that a patient's extended health benefits insurance may not cover group exercise class. So it's really important to have that conversation with your patients and encourage them to check in with their health plans just to ensure that they would be covered for this. And a decision to fund group exercise classes through extended health benefits, it's an insurance policy, not a college policy. But regardless, the college's rules for assigning care to group classes to a PTA, we must ensure that all the different rules are followed. So the next scenario we're going to be looking at here, it's going to be around oxygen supply. So Fiona, you have a physiotherapist who wants to is asking their PTA to switch the patient's oxygen supply from the wall to a portable tank. What are some of the responsibilities that the physiotherapist in this scenario still retains for the patient care?
Abbi, I know you mentioned this at the beginning, and it was one of the questions we asked on the PISA, and we know that many people answered incorrectly, so it's good we're going over it. So oxygen administration is a controlled act, and it can be delegated by the PT to a trained physiotherapy assistant, but the PT retains responsibility for safety in the delivery of the care. If the PTA, remember, is changing the delivery of oxygen from the wall to a portable tank, they'll need to set up a portable oxygen system, and obviously delegation is required for that. This activity involves risk, and the PTA will require special knowledge. The PTA will need to, if you think, and make sure the tank is returned on, has enough oxygen in it. They will need to make sure that they reconnect the hose to the oxygen supply and not the air valve. They must know the delivery of oxygen and the correct delivery of oxygen that's required in the medical order. They need to know if humidification is needed. And they likely will need to measure oxygen saturation during the activity. So do they know how to change the flow rate, when to change the flow rate, when to contact the physiotherapist if they're noting any issues or concerns? So the physiotherapist is responsible for all of that to make sure the PTA is competent, knowledgeable, knows when to communicate and reduce or mitigate the risk to the patient. The next question to you, Abbi. Its physiotherapist has been offered a role at a clinic. That physiotherapist would be assessing patients and delegating most treatment plans to the PTA. What are the responsibilities to the patients and to the PTAs in this scenario?
So the physiotherapist certainly has lots of responsibilities to both the patient and the PTAs before proceeding with this kind of scenario. Firstly, again, the physiotherapist always remains responsible for conducting that assessment, right? And developing the patient management plan, coming up with that treatment plan. As we know, each patient will have different needs. And based on this, they'll have different goals, and that could depend on the chronicity of the conditions, morbidities, and such. The responsibility of the physiotherapist here is to the patient is to discuss the assessment findings with them, and also to develop those patient-centered goals and the target dates to achieve these goals. The PT also needs to commit to a reassessment time with the patient, and if they're assigning any part of the care or all of the care to the PTA, they must have a system to ensure that the PTA delivering the care can do so safely. So this is where, again, we're going to be taking a look at that. What is the PTA's competency level? So in order for them to ensure that they're able to actually carry out this treatment plan that's been developed for the patient. The PT needs to ensure that if the PTA needs any additional training before carrying out the plan, that this is done with the PTA. It also needs to ensure that before including the PTA in the patient's care, again, this comes back to that consent piece, having that conversation with the patient about the PT's role, the PTA's role before getting the PTA involved and ensuring the patient actually consents to the PTA being involved in their care. There should also be, again, it comes back down to that communication process, particularly if they're assigning most of the treatment to that PTA. They need to ensure that there is a communication protocol in place as to when and how they're going to be meeting, and when will the PTA need to contact them in case of any changes or any questions the patients may have. All right, thank you very much for watching the webinar on working with PTA Standard based on this year's PISA. If you have any questions, please contact myself, Fiona, or MC. We're definitely happy to help and answer your question. Remember, the practice advisory service is free and confidential. And as we mentioned, there are additional resources that can certainly help further your learnings that you and your PTA could do together, such as that working with PTA e-learning module we have on the college's website. There's also that PTA competency checklist that we spoke to that you can utilize to assess the competency of your PTA. Again, this is just showing you just a screen grab of that working with PTA e-learning module. Again, like I said, this is something that you can find in that working with a PTA standard. And again, this is our contact information here at the college. That's the email address for the practice advice, and along with our phone numbers. We're certainly, like I said, available. Myself and Fiona and MC are available to help in case you have any questions for us. Thank you.